Now let's take you down here to Nigeria, where some health matters now. Yes, in Bauchi and Ebonyi States have recorded a new death from Lassa Fever as the nation's toll from the disease since the beginning of 2021 begins, well, rises again, this time to 92.
Now, the Nigerian Center for Disease Control, that's the NCDC, disclosed in its latest situation report on the outbreak of the disease for the report for week 50, which covered December 13 to December 19, where it showed that 3 more deaths were reported in the week under review. Now, while Bauchi recorded 2 new fatalities, Ebonyi recorded a new death from the disease. Insight on Lassa Fever outbreak in Nigeria, we have Dr. Oladapo Ashinyobi. He is a public health physician and sustainable development consultant. Many thanks for joining, Doctor. Now, with this report that we're getting now, this report that we're seeing from this Lassa Fever update, it's quite scary. I mean, the death toll has risen to 92, all in the year 2021. How did we get to this level?
Good morning, viewers. Well, it's not strange. It's expected. Last year was actually a bit worse. We had over 5,000 cases and over 1,000 deaths. And this year, I think we have done better. And we can explain what happened last year. It was the COVID year, so people, not many people could move around and access health service. So this year we've had 4,273 suspected cases, 544 confirmed, and 92 deaths. Last is likely surveillance is better, then people are able to access services faster now that we even know how to quickly diagnose COVID and rule it out. So we're doing actually much better. Last year, 130 local governments were affected up to now. But this year is just 66. So that means if you look at the spread, we've contained it. However, the worry still remains that the hotbed states, which I call the EOE states, Ebonyi, Edo, Ondo, and Ebonyi. Edo being the highest, has 83% of cases, followed by Ondo, then Ebonyi. Now, I think what we need to do is prioritize how we manage and cases will be gone. So let me give you an example. In the Mano River region, that is where you have Sierra Leone, Ghana, and one other country, and Liberia. They see Lassa the way we see malaria. So the moment anybody complains of fever in Sierra Leone, the first thing they want to know is that it is not Lassa. So they equate it even higher than malaria. So that
the Lassa fever is recognized to be an endemic in many parts of West Africa, just like you pointed out, Benin Republic, Ghana, Mali, the Mano region, River region area, Sierra Leone, Liberia, and Guinea, and the likes. Now, how does it really spread, and what are the symptoms that Nigerians should be wary about right now for Lassa fever?
All right. So, as you can see, those regions have similar environmental factors to processing. So they put it on the floor, and it's easy for rats to just walk over them and wee and poo on these products. They are so tiny, they become contaminated. And it is in this matter that the Lassa fever virus remains. And then people easily take gari or yam. The gari is so easy. You just quickly put it in water and you are gone. The same thing with the yam so quickly. So people contract it from being in contact with the rodents, a special rodent that's for mice. And so that's where the issue is. If you're able to remove the contact between the rodent and the food that man eats, so we can help them change their food processing, so they will not need to spread food, raw agricultural food on the floor. Maybe use an oven, and then when they finish, before they sell, they bag it and put it in rat-proof containers. So they can't put it in sacks that rats can just nibble, and you get all this wahala. So if we're able to do that a lot, we would have helped improve the break the chain of transmission. And then when it now happens, I mean, peradventure 1 or 2 or 3 or 4 or 5 cases, the health system at the primary care level quickly knows how to recognize and treat every case of fever in those areas as Lassa until
Doctor, I mean, you've told us some of the ways with which we can curb or even avert the spread of Lassa fever. Now, for this year alone, a total of 99 deaths has been caused by this Lassa fever in Nigeria. And we know that in this same year, 2021, we had to grapple with COVID-19. We had to grapple with Omicron. We also had cholera outbreak in this year. Now, our healthcare workers, we've heard of them actually relocating, the so-called Japa situation. How prepared are we, the doctors, I mean, the healthcare workers, the nurses, the scientists, are they not overwhelmed as we speak?
Okay, so first things that I need the public to take away so that we'll not forget. One, in these regions where it is possible, Edo, where it is very common, Edo, Ondo, Ebonyi, then maybe Taraba and Plateau, please let every community member and health worker know that first for them, if there is a fever and joint pain, just think of Lassa first to diagnose, who have to vaccinate, who have to treat every other regular symptom. That we are overwhelmed is an understatement. With or without the so-called brain drain that we call Japa syndrome, we do not have enough workforce. Less than 30% of the health workforce we need is what we operate with. And therefore, one person is doing the work of 3.5 people already. Now, the immigration brain drain worsens it. However, I think the government and everybody needs to re-innovate and replan and ensure that they ramp up production of health workers. When we ramp up, we incentivize them, because the only reason they are going is because what they get there in 2 to 3 months, some of us who are here don't get it in 2 years. So if you incentivize them, then they will stay. There is actually no place better than home. But if home is not conducive, then you have to look for most of them are just economic migrants. That's one. Secondarily, technical migrants. So give them incentive in 2 fronts. One, the take home, and more importantly, the work environment. There is nothing as bad as wanting to save a life and not having the tools to save that life with. So if you give them both technical and economic incentives, they will stay.
Dr. Oladapo Ashinyobi for coming on Breakfast Central today. Lots to chew on in terms of Lassa fever, so we have to stay aware and stay sharp, stay awake, and also keep perhaps social distancing measures for letting from COVID-19 into this one. Thank you once again, Dr. Ashinyobi, a public health physician and sustainable development consultant, for coming this morning on Breakfast Central.